I rise to indicate the government's support for the order for papers moved by the Honourable Mark Banasiak and thank him for moving an amendment to extend the timing from 21 days to 28 days. The Minns government strongly believes that tunnelling workers should be able to work on sites where the risk of exposure to crystalline silica is managed as safely as possible. Inquiries by this House into respirable crystalline silica air monitoring in these projects is therefore not opposed. Since coming to government, we have taken strong action to keep workers at risk of exposure to crystalline silica safe. Last year we banned engineered stone. On 1 September this year, we were the first jurisdiction to introduce the crystalline silica substances regulation into the state's work health and safety regulations. These regulations provide that employers in at-risk workplaces undertake air monitoring and provide results to the WHS regulator where they indicate the airborne concentration of respirable crystalline silica in the workplace exceeds the workplace exposure standards and mandate health monitoring for workers. The government also passed legislation last year to establish a silica worker register, and work is progressing to bring that register into place. I also note that the Law and Justice Committee is currently reviewing the Dust Diseases Act, which provides the framework for compensation for occupational dust-related diseases. The government is eagerly waiting for the reports from that review. Mr. President, I also want to acknowledge the advocacy of unions to make work safer in at-risk workplaces, including the AWU, who cover workers in the tunnelling industry, and also wish to acknowledge the interest of Ms Abigail Boyd in this matter. Just generally, Mr. President, this is a very, very important call for papers. I commend the member for bringing it. It's important that we have access to those records. Having been involved in the electricity industry for many, many years, when mesothelioma caused by asbestos fibres was the big enemy, public enemy number one, we had air monitoring in those workplaces, which was a crucial ingredient to us dealing with asbestos, what they call friable asbestos liberated into the air, and having the proper protective clothing equipment and breathing apparatus was critical for us to be able to deal with that in a safe way. Now, engineered stone was the emblematic issue which we dealt with first, but tunnelling is just as, if not more, pernicious. And again, commend the AWU for bringing this to our attention and the member for asking for these records, because it's important that we get that information on those work sites for those workers.